my name is Sinead McGilloway and I'm Principal Investigator of the Maynooth University PRIMERA research project. This research focused on parental mental illness in Irish families. The evidence suggests that almost a quarter of all families, around 23%, have at least one parent who has or had a mental health disorder. We know that this vastly increases the lifetime risk for children of developing serious mental illness themselves, as well as physical illness and impaired educational and occupational outcomes. This also places a substantial burden on partners and children who can sometimes act as caregivers themselves. Unfortunately, these vulnerable families often remain invisible and are not identified or supported by mental health professionals due to, for example, a lack of policy practice guidance, little or no collaboration between adult mental health and child and adolescent mental health services, an individualised, crisis-oriented approach to assessment or treatment, competency and confidentiality concerns amongst mental health professionals, some of whom may feel ill-equipped to undertake family work. And lastly, parental stigma or fear of social services on losing custody of the children. Our PRIMERA research programme, an acronym for Promoting Research and Innovation in Mental Health Services for Families, was funded by the Health Service Executive in Ireland, and it enabled us to identify, develop, implement and subsequently evaluate family-focused practice for families with parental mental illness in Ireland. In consultation with practitioners, families and HSE management, an intervention called Family Talk was selected to be implemented and evaluated across a number of adult, child and primary care mental health services in Ireland. Family Talk is a whole family 7-session approach or intervention designed to improve family communication and resilience when a parent has a mental illness. This research was important. It was the first endeavour to systematically implement and evaluate family-focused practice for families with parental mental illness in Ireland. It is also one of the first randomised controlled trials and cost analysis of Family Talk in Europe, and only the second qualitative study ever conducted to explore practitioner and family experiences in implementing Family Talk. Our findings illuminate the successes and complexities of implementing Family Talk in a country that doesn't have a think family infrastructure, whilst highlighting a number of important generalisable lessons for the implementation of Family Talk and indeed other similar interventions elsewhere. Now I'm going to hand over to my colleague, Sharon McGarr, who's going to tell you a little bit about the families who took part in our research.
The PRIMERA research programme included 86 families, 360 parents and children in total, across several sites in Ireland, including adult, child, primary care mental health services and TUSLA child protection services. Families were randomly allocated to receive the Family Talk intervention or a usual service control group and assessed at pre-intervention and at 6-month follow-up on the key outcomes. We also conducted in-depth interviews with 45 parents, partners and children. 2/3 of parents in the study had depression, anxiety, others had bipolar disorder, borderline personality disorder, psychosis or post-traumatic stress disorder. 40% of children were attending CAMS or another psychology family support service. Our trial results showed that when compared to the services as usual group, children in the Family Talk families had significantly fewer behavioural and emotional problems, including lower levels of depression, at the 6-month follow-up, while parents reported improved mental health symptoms, greater resilience, better coping capacities and better mental health literacy. General family relationships functioning also improved in those who had completed the Family Talk programme. Over 2/3 of families who took part in interviews across adult and child mental health settings and with different mental health diagnoses also reported these and other substantial benefits, including reduced stigma, giving children and partners a voice, for example, a space to disclose hidden concerns and burdens, and increased confidence and well-being in the service user parent. Families believed that Family Talk worked best when delivered by a competent, non-judgmental clinician, when the family was ready to engage and when the perspectives of all family members were heard and valued. About 1/3 of families experienced some barriers to engagement, including parental stigma, family crisis and relapse in parental mental health, which meant that the family couldn't continue with family talk. Service constraints, especially due to the disruption in delivery caused by COVID-19. And some families may need further child, family and follow-up session supports. The findings showed that family talk was beneficial across different mental health settings and diagnoses, indicating a no wrong door approach to identifying and supporting families. However, family talk may not be suitable or sufficient for all families and should ideally be implemented as part of a suite of lower and higher intensity family-focused interventions. There is an urgent need in Ireland to introduce Think Family practice guidelines, as has been done elsewhere, so that a multi-level public health response can be developed to identify and support these families. I'm now going to hand you over to the Research Project Manager, Dr. Mairead Furlong.
Very little research to date has investigated the experiences of clinicians in delivering family talk within community mental health settings. We conducted in-depth interviews and focus groups with 41 clinicians and managers who had been involved in the PRIMERA programme of research. More than 80% of practitioners were employed with the adult and child mental health services, including mainly social workers, but also social care workers, clinical nurse specialists and psychologists. Similar to our family participants, service providers reported benefits for approximately 2/3 of families across different diagnoses and mental health settings, including reduced worry and stigma, a greater understanding of the impact of parental mental illness on family members, and improved family communication. Perhaps not unexpectedly, sites varied in their capacity to successfully embed family talk with key enabling factors such as firstly, adequate managerial and organisational support and resources, secondly, clinician skill and interest in family-focused practice, and thirdly, establishing interagency collaboration across adult and child mental health settings. Implementation challenges included, firstly, recruitment difficulties due to parental stigma, concerns about discussing the topic with their children, and relapse in parental mental health and family crises. Secondly, there was a resistance to family-focused practice from some clinicians and managers due to resource constraints and because it was different to their usual more individualised and crisis-oriented way of working. Thirdly, there was extended disruption in delivery due to COVID-19. Our clinician-focused findings show that family talk can help families across different mental health settings and diagnoses. The results also illustrate several resource-related and ideological barriers that could undermine the longer-term sustainability of family-focused practice, particularly in the absence of appropriate policy guidance. A multi-level public health response is required to address these, including in particular Think Family policy and practice standards and dedicated funding for family-focused practice. These standards might include the following. Firstly, auditing of the parenting status of adult mental health service users. Secondly, balancing the priority given to patient confidentiality with unmet family needs. Thirdly, equipping clinicians with the time and resources to undertake family-focused practice. And lastly, increasing the collaboration between traditionally segregated adult and child mental health services.
Thank you all very much for watching this video. We hope that our research findings inform policy and practice, not only in Ireland, but also internationally. If you'd like any more information, please click on the link below.